Dr. Barrett, welcome to Pharmacoms TV. To start off, can you give us a bit of background to your career to date?
Thanks so much for having me. I'm a cardiologist by training with a special interest in preventive cardiology and also in digital medicine. I think fundamentally these are two very complementary ways of looking at changing behavior, which is often one of the key determinants of how we reduce cardiovascular risk. And I think using the digital health tools that we're seeing coming online is one of the key ways of doing that.
And where did you train and study?
So originally a graduate of medicine from University College Dublin 2005 and did the training schemes in Ireland partially and then trained in the United States with fellowships in digital medicine and also in interventional cardiology in New York.
How important is patient centricity and how does it work with digital tools?
Patient preference, collaborative shared decision making has become, I think, the centerpiece of modern medicine. And I think even when you include extending lifespan, some patients will not take that if the impact on their morbidity or their quality of life actually will deteriorate. So I think we have, made significant efforts in terms of how to have that collaborative discussion, how to improve health literacy for patients so they can make those decisions. And because things have reached a degree of complexity, the platforms we use to educate our patients, to help us with shared decision making, have been advantaged by the digital platforms that are in place in terms of how we can think about the decisions that we make, in terms of how the decision to, say, have a procedure will affect a patient in terms of their quality of life, in terms of the decisions that a patient will make from a behavioral change point of view, how they're likely to feel. And I think it is very much enabled by the technology pieces that we now have available to us to really help us, I think, have patients understand the implications of their decisions, both in a positive and negative way, but ultimately to serve the patient's needs.
Can you talk about VR and technology in pharmacology?
So much of risk reduction in most of chronic disease, but particularly in cardiology, is about behavior change. So we need to leverage the tools that have been well described in neuropsychiatry in terms of how to change behavior. And we have lots and lots of cognitive biases that really limit us in terms of thinking about long-term change. And I think that is just a fundamental aspect of our human nature. We are designed to think over the shorter term, and we need to leverage the tools to be able to explain what will happen over the longer term so as to change behavior over the short term.
Obviously, a lot of what is common across all of these new platforms and new technologies is data. What are your views on data ownership?
Particularly to tools like the Apple Watch, I think, again, they're not changing how we practice medicine in terms of the type of medicine, but they change the models of care. I think we've had an acceleration in the technologies, but we haven't had the same pace of change in the ecosystems within the healthcare systems to accept that information. So now when a patient wants to send a doctor of theirs that information, it's done in a very clunky format, and I think our healthcare systems are not set up to accept and integrate that. And the real, I think, advances we're going to see is going to be really robust digital infrastructure architecture, data management, interoperability of those data standards, so as that we can accept any form of technology, any form of data to integrate into our healthcare systems.
Finally, are you optimistic about the future of the healthcare industry?
So I am incredibly optimistic. I think it's easy to be pessimistic, but I think that just shuts down your perspective in terms of what's possible. So there's no doubt that we have escalating healthcare costs. There is no doubt that we have a tsunami of chronic disease. There is no doubt that we have a tsunami of people being very disenfranchised, both within the healthcare services around how they deliver healthcare, and also patients being very disenfranchised. With all of that being said, I think we have incredible opportunities to make a difference.